Autumn milk matters. As volumes drop and solids rise, every litre counts. But high somatic cell count, or SCC, or mastitis can undo months of good work. In this video, we'll walk through best practice practical steps to tackle incidences of elevated SCC and mastitis. High SCC affects cow health, product quality, and ultimately milk price. Chagas research shows mastitis can cost over €117 per cow per year. In autumn, cows are more exposed to changing diets, wetter conditions, and housing, increasing the risk for spikes in cell count and cases of mastitis. Step 1 is to identify and record. Start with individual cow cell count information, ideally through milk recording. Other options are individual cow results from samples tested in the Tirlán lab or inline sensors in your parlour or robot. GenoCells is also an option for genotyped herds. The AHI cell check recommendation is to plan 6 milk recordings per lactation and to use this information to identify problem cows in the herd. Force strip these cows at the next milking and use the California mastitis test to pinpoint infected quarters. The frequency of individual cow cell count testing needs to be increased when dealing with the spike in SCC. This gives you accurate information on the current situation, allowing you to discuss this with your vet or milk supply manager and identify the persistent and the new cases and manage these accordingly. Step 2 is to avoid spreading mastitis. Aim to milk infected cows last, use gloves, and disinfect clusters between cows, either by using a peracetic acid cluster dip or a cluster flush system. Once housing cows again this autumn, maintain clean cubicles, applying fresh lime twice daily. Step 3, talk to your milking parlour technician to service and test the machine, checking for air leaks and vacuum and pulsator irregularities. Don't wait to do this until all the cows are dried off and the parlour is shut down for the winter. Step 4 is, if not done recently, take a sterile milk sample from a recently infected quarter before treating to determine the infectious cause of mastitis and a suitable treatment. Treat clinical cases promptly and record treatments. For chronic cows, those that have already been treated this lactation or those that did not cure during a previous dry period, consider early drying off or even culling to remove them as a possible source of infection for the other cows in the herd. Step 5, for spring calving herds, autumn is the gateway to the dry period. Use selective dry cow therapy based on individual cow cell count data from milk recording or other frequent monitoring. Use internal teat sealants on all cows and avoid blanket use of antibiotics to reduce the risk of antimicrobial resistance developing in your herd. High SCC and mastitis cows will benefit from a longer dry period. Plan to milk record early in the next lactation to accurately determine dry cow treatment success and make a decision on whether these cows can stay in the herd or should be culled to protect the other cows. We have covered the steps to take during a spike in SCC or increased incidence of mastitis in the autumn. The crisis is averted. In the next video, we will discuss how to maintain SCC in a good place long term and prevent future spikes. Autumn milk is only high value if it is top quality milk. Use your SCC data, follow the AHI cell check guidelines, and protect your herd's health and your bottom line. For more detailed information on how to tackle incidences of high cell count and mastitis in your herd, check out our other videos on the Tirlán Farm Life YouTube channel.